Did you know? 1 in 3 seniors have heart disease without even knowing it. Mike, chest pain, shortness of breath, rapid heartbeat. It seems normal, but it can be a warning sign of an impending heart attack or stroke. Mike, don't wait until it's too late. Today, let's explore with Senior Health 365 the dangerous signs of heart disease that everyone needs to know to protect their health right now. Mike, watch until the end of the video for the health of yourself and your loved ones. 1. Chest pain. The most common sign. Mike, have you ever felt pain, tightness or discomfort in your chest without knowing the cause? Don't be subjective. This could be a sign of coronary artery disease or an impending heart attack. Mike, angina occurs when blood flow to the heart is reduced due to blockage or narrowing of the coronary arteries. This symptom often appears when you exercise vigorously, climb stairs or are stressed, and can be relieved by resting. Mike, the pain may spread to the arms, back, neck or jaw, accompanied by shortness of breath, nausea or cold sweat. If the pain lasts longer than 5-10 minutes and does not subside, call 911 immediately. Small diamond. According to the American Heart Association, AHA, chest pain is a symptom of more than 70% of myocardial infarctions. Small diamond. A study from Harvard University shows that 43% of myocardial infarction patients do not recognize the early signs, leading to delays in treatment. Mike, tip. If you have signs of frequent chest pain, widespread pain or accompanied by fatigue, dizziness, get a health check immediately. This can help you detect cardiovascular disease early and prevent dangerous complications. 2. Shortness of breath, breathlessness. Signs of heart failure. Mike, do you often feel short of breath when climbing stairs, lying down to sleep or even when resting? If so, don't ignore this sign. Mike, shortness of breath, dyspnea, is one of the important symptoms of heart failure, a condition in which the heart cannot pump enough blood to meet the body's needs. When the heart is weak, blood stagnates in the lungs, causing fluid to accumulate, leading to shortness of breath and a feeling of heaviness in the chest. Mike, signs of recognition. Small diamond. Shortness of breath on exertion occurs when climbing stairs, walking quickly or carrying heavy objects. Small diamond. Shortness of breath when lying down, feeling of chest tightness, shortness of breath when sleeping, having to prop up a pillow or sit up to breathe easier. Small diamond. Shortness of breath at night, paroxysmal nocturnal dyspnea (PND), waking up suddenly because you can't breathe, possibly accompanied by a dry cough or a cough with frothy phlegm. Small diamond. According to research from the Mayo Clinic, up to 80% of patients with early-stage heart failure experience frequent shortness of breath. Small diamond. The National Heart, Lung, and Blood Institute, NHLBI, points out that shortness of breath due to heart failure can appear before the patient even discovers the disease. Mike, advice. If you have persistent shortness of breath, even when resting, accompanied by fatigue or swelling in the legs, see a doctor immediately. Early detection can help control heart failure and prevent dangerous complications. 3. Irregular heartbeat. Atrial fibrillation. Warning. Mike, have you ever felt your heart beating abnormally fast, fluttering, skipping beats or pounding in your chest for no apparent reason? If so, be careful. This could be a sign of atrial fibrillation, a dangerous heart rhythm disorder. Mike, atrial fibrillation, AFib, occurs when the electrical signals in the heart are disrupted, causing the atria to contract out of sync with the ventricles, leading to a rapid, irregular heartbeat that can reach 100,175 beats per minute. Mike, more dangerously, atrial fibrillation increases the risk of blood clots, leading to stroke or heart failure. According to experts, people with atrial fibrillation have a 5 times higher risk of stroke than normal people. Mike, signs of atrial fibrillation. Small diamond. Abnormally fast heartbeat, fluttering feeling in the chest. Small diamond. Skipped beats, nervousness, palpitations lasting for several minutes or hours. Small diamond. Dizziness, fatigue, shortness of breath, even mild chest pain. Small diamond. According to the European Society of Cardiology, ESC, 1 in 4 people over the age of 65 have atrial fibrillation, but many people do not detect the disease in time. Small diamond. Research from the American Heart Association, AHA, shows that atrial fibrillation is the cause of 15–20% of strokes due to blood clots. Mike tip. If you often feel rapid heartbeat, palpitations, dizziness for no apparent reason, see a doctor immediately. Early detection and treatment can help control heart rate, prevent blood clots and reduce the risk of stroke. 4. Swollen legs, ankles, a sign of heart failure or high blood pressure. Mike, have you noticed unexplained swelling in your legs, feet or ankles? If so, be careful. This could be a warning sign of heart failure or high blood pressure. Mike, why does heart failure cause swelling? When the heart is not working properly, it cannot pump blood effectively, leading to blood stasis in the veins of the lower limbs. Increased pressure in the blood vessels causes fluid to be pushed out of the tissues, causing swelling in the legs, ankles and even the abdomen. Mike, in addition to heart failure, swelling is also associated with small diamond high blood pressure. High blood pressure can damage the walls of blood vessels, causing fluid to leak out and cause swelling. Small diamond kidney disease. When kidney function is impaired, the body cannot eliminate excess salt and water, leading to fluid accumulation. Small diamond chronic venous insufficiency. Weakened venous valves cause blood to flow backward, causing swelling in the legs. Small diamond. According to the American Heart Association, AHA, up to 60% of heart failure patients experience leg swelling due to fluid retention. Small diamond research from the Mayo Clinic shows that leg swelling is one of the early signs that help detect congestive heart failure. Mike tip. If you have persistent leg swelling, a dimple when pressed, accompanied by shortness of breath, fatigue or unusual weight gain, get checked immediately. Early detection can help control heart failure, high blood pressure and prevent dangerous complications. 5. Dizziness, fainting. Signs of poor blood circulation. Mike, have you ever suddenly felt dizzy, lost your balance or even fainted? This is not only a sign of temporary cerebral ischemia, but can also warn of low blood pressure, heart valve disease or the risk of stroke. Magnifying glass. Why does poor blood circulation cause dizziness? Small diamond low blood pressure. When blood pressure drops sharply, the brain does not receive enough oxygen and nutrients, causing dizziness, especially when standing up suddenly. Small diamond heart valve disease. Aortic valve stenosis or heart valve regurgitation reduces the amount of blood pumped to the brain, causing fatigue and dizziness. Small diamond carotid artery stenosis. Atherosclerotic plaques narrow the arteries that supply the brain, increasing the risk of transient ischemic attack, TIA, which can lead to stroke if not controlled. Pushpin. Warning signs of danger. Checkmark. Prolonged dizziness, frequent loss of balance. Checkmark. Accompanied by severe headache, numbness and weakness on one side of the body. Stuttering can be signs of stroke. Checkmark. Feeling short of breath, chest pain, rapid heartbeat can be related to cardiovascular disease. Small diamond. According to research from the American Stroke Association, up to 40% of patients with mild stroke have had symptoms of dizziness before. Small diamond. A study from the Mayo Clinic also showed that unexplained dizziness in the elderly may be related to cardiovascular disease and blood pressure disorders. Mike tip. If you experience frequent dizziness, especially accompanied by symptoms such as loss of balance, headache, slurred speech or numbness in the limbs, see a doctor immediately to check your cardiovascular and circulatory health. Early detection can prevent the risk of stroke and other dangerous complications. Cardiovascular disease is a silent killer, but if detected early, you can prevent it. Mike, pay attention to the above signs and don't forget to maintain a healthy diet, exercise and get regular health checkups. Mike, if you find the video useful, please like, share and subscribe to Senior Health 365 channel to update more information about old age health. Mike, thank you for watching. See you in the next video. Sparkling heart.